We've hit a tragic new milestone in the COVID-19 epidemic in Australia, with the highest number of deaths recorded in a 24-hour period, with 25 people losing their lives to COVID-19. And my heart goes out to friends and family who are mourning deaths of loved ones today. There are 674 people currently hospitalised with COVID-19, and 51 of those are in intensive care. Notably, this is in a context of us surpassing 21 million cases internationally in the COVID-19 pandemic. And so in light of that ongoing spread of COVID-19, this need for all of us to adapt to a new normal, I'm pleased to be able to present to you today and launch a new ad campaign today that reaffirms how easily and rapidly this virus can spread amongst all of us in the community, but especially among young people. As you'll see in a moment, when we view the ad, it clearly and emotively and engagingly demonstrates how fast COVID-19 can spread, often without us knowing about it, showing also the severity of the virus and the impact that it can have, not just on ourselves, but more importantly on our loved ones. The ads are a reminder that no matter where we are in Australia, particularly those states, those 7 out of the 8 jurisdictions where we have little to no COVID-19, that we all need to remain vigilant. It's a timely reminder, given the number of deaths in Victoria today, that we need to do everything we can as a community to bring this virus under control. We need to be constantly mindful, and that doesn't matter whether we are in our teenage years, our young adult years, middle-aged like me, or whether we're elderly Australians. We all need to be mindful and aware of how easily COVID-19 spreads. It's particularly important, of course, for younger Australians to be aware of this. Why is that? Well, because unlike influenza, COVID-19 predominantly spreads throughout the age group of 20 to 29-year-olds, and those statistics hold in Australia. 20 to 29-year-old Australians have the highest rate of infection, 77 cases per 100,000. Then it's followed by 30 to 39 years with 59 or 60 cases per 100,000. And then after that, 60 to 69-year-old Australians with 56.5 cases per 100,000. And we know that people between the age of 20 to 29 have milder symptoms often. That means that they're far more at risk of spreading the virus to others. Often it's very hard when you've got mild symptoms from a respiratory virus to convince yourself that you need to stay home and get tested. But it's so critically important that we do. And even though, as a proportion, 20 to 29-year-olds have less of a risk of severe disease, we know from cases around the world that young people can find themselves in intensive care, young people can find themselves very unwell with COVID-19, and COVID-19 may even be fatal to young adults. Now, one of the challenges, of course, is that when you're in your late teenage years or in your 20s, this is the time when you're often in your second or third job. These are jobs that are often forward-facing with the community in the hospitality industry, for example. Young adults often may find themselves in a highly casualised employment where it's difficult to get sick leave. All this is recognised. We also recognise the deep effects that the COVID-19 pandemic have had socially and economically for young adults, with many losing jobs in the hospitality industry. What this ad is about is to show young Australians that the way forward is to control the virus as quick as possible. The way towards economic recovery, the way towards getting jobs back, is to bring those numbers down. So we act as a whole community. We each do our bit, and our bit differs from whether we're in our late teenage years or young adults throughout whether we're in middle age or we're elderly Australians. We've all got our bit to play, but this ad will show us that there are very specific things that young Australians can do to protect vulnerable people in their families and in the community from COVID-19. And I'd like now to be able to show you this ad on the screen.
I see you with COVID. We visited her a few weeks ago, but I didn't know that I had COVID. I had no symptoms. A week earlier, my mate cooked dinner. Tom said he just had a cold. He works with Sophie. He said she just had a sniffle. We all had COVID and didn't know it. We can't change that, but we can all change what we do in the future. Be COVID safe and save lives. Visit australia.gov.au, authorised by the Australian Government, Canberra.
As you can see, a very emotive, evocative ad that shows clearly how easily COVID-19 can spread from person to person and how clearly someone who is a vulnerable member of our community could acquire COVID-19 from younger friends and family. And with that in mind, I'll take questions.
I'm just wondering on this ad, are there specific statistics you've seen around Victoria that potentially young people are flouting the rules and spreading the virus, or is this a circumstance of jobs and the kinds of industries they're in?
Well, I don't think this is specifically targeted at all at young people because they're flouting the rules. This is about reminding young people how easy it is to transmit the virus, how people can have very mild symptoms and potentially not get tested, potentially still go to work. I think you saw the example of the barista there on the ad. I mean, this sort of thing can happen throughout the country, and we're not specifically looking at Victoria with this ad campaign. In fact, these ads will not run in Victoria. Other federal government ads will continue to run down there. But this ad campaign is specifically for those states and territories now, the 7 of the 8 states and territories which have little to no coronavirus at the moment. And the reason for that, of course, is because we need to make sure that community outbreaks, cases of COVID-19 in those states and territories are contained. And one of the important ways to contain them is to have people continuing to exhibit the behaviours that will stop spread: physical distancing, hand hygiene, and most critically important, staying at home, avoiding work, avoiding socialising when you're unwell, getting yourself tested. And once that test is negative and you feel better, getting out there again and socialising and going to work in a COVID-safe way. Claire.
Dr. Coatsworth, the National Cabinet is working on a plan to deliver more face-to-face PPE training to the aged care sector. Could you step through what the benefits of doing that in person might be, and if there are any estimates on how many workers you expect will be able to have that in-person training, either instead of or in addition to the online training rolled out at the start of the pandemic?
Well, thanks, Claire. I mean, I think the first thing to say is that the need for infection control training in residential aged care facilities, infection control training against the spread of a respiratory virus, is not new to the COVID-19 pandemic. We've required this every year in the flu season for providers and facilities to be able to make sure their staff are well trained and also to stop outbreaks of respiratory disease. That said, it is clear that we need to make sure that training is reinforced as much as possible. Personal protective equipment training, the ability to put it on or donning and taking it off or doffing correctly, is a really important part of wearing the PPE and stopping cross-transmission. How might that happen? Well, there's a variety of ways that face-to-face training can take place. At the moment, down in Victoria, it's taking place through the AUSMAT flying squads who are going in to severely affected facilities. For the facilities that aren't as severely affected, there's a very strong cluster model emerging where the main referral hospital is providing the infection control training face-to-face. And of course, providers having their own experts in infection control, which is something that they've been required to access for quite some time. So there's a whole variety of ways. In terms of the absolute numbers of people that receive face-to-face PPE training, I would simply say that the best way to learn PPE is face-to-face with someone teaching you. So no matter, there'll be a variety of ways that can be done, but that would be a desirable thing to happen.
Just a couple of things. One, on the advert, do we have a dollar figure on how much this campaign to really spread this message, do we have a figure on how much that costs?
Well, I'm the senior technical medical advisor to government, so I don't have those figures to hand. But suffice it to say that the government is prepared to spend money on excellent ads like this one to be able to deliver the message we need to control COVID-19.
On to mental health, are there still concerns that mental health, there are other mental health concerns for Australians across the country, not just in Victoria? And if so, how do you respond to calls for increased support for mental health, like uncapping those 10 psych sessions? I know it's been done for Victoria, there are calls that actually done more broadly. Lots of people are suffering mental health, but what is your response to that?
Well, I completely acknowledge that the COVID-19 pandemic has created mental health stress across the country, and there have been a variety of national programs funded by the government to be able to address that. But specifically what we heard today in Victoria are some very concerning and distressing numbers, increases in the proportion of young people presenting to emergency departments with self-harm, for example, marked increases in the number of people accessing those traditional mental health services that we've come to know so well, such as Beyond Blue and Lifeline. So there is a clear need for a rapid intervention in Victoria at the moment, and I think the people around Australia will appreciate that money needs to be targeted, focused to those in stage 4 and stage 3 lockdown in Victoria, and that we all, as members of the Australian community, recognise that Victorians are going through something that's deeply challenging at the moment and require that assistance.
Dr. Coatsworth, there's been some concern about, following the mass spread in aged care facilities in Victoria, that this could spread into the disability sector and disability homes. What is the government doing, and what's the AHPPC doing to prepare that sector? And what are the similarities and differences between that sector and the aged care sector that potentially make this response quite different?
Well, I think there's a variety of similarities, and that's reflected in the fact that the main the Communicable Disease Network of Australia plan is for residential care facilities. That applies to residential aged care facilities as much as it applies to disability and supported accommodation. That said, there are very specific needs for Australians with disability, keeping in mind that disability is not a catch-all term for the many millions of Australians who live with disability. Many Australians have different disabilities that render them have different susceptibilities to COVID-19. Not all, as I discussed with the Disability Discrimination Commissioner Ben Gauntlet some weeks ago, not all Australians with disability are more susceptible to infection with COVID-19, and equally some Australians with disability are very susceptible to infection with COVID-19. So there's a variety of tools or things that we've implemented in government, including the Disability Advisory Committee, which is within the Department of Health, and the liaison that we've had with the National Disability Insurance Scheme and Insurance Association has been very productive to that end.
Is the AHPPC watching what's happening in Auckland, New Zealand, in terms of the cluster there, and is that somewhat a test case for what happens when you totally remove social distancing and then have the virus unknowingly re-enter the community? Is it proof that we will need to keep having these measures in place until there is a vaccine?
Well, we share information all the time with our colleagues over the ditch, and that's a very important thing that we can do with each other to learn. It's not necessarily the case that were we to experience 102 days without a coronavirus virus case that we would do exactly the same thing as New Zealand. That, of course, would depend a lot on the context of the outbreak. But in terms of detailed information sharing, we do that. In terms of whether it's a model for what will happen in the future, we just have to wait and see how our epidemic progresses.
Just on the vaccine, with the Russians starting to roll out a vaccine by the end of this month, Kudotti said that it was a reasonable thing to do with risk-benefit analysis, and just given they're following quite standard protocols and have quite safe tech. Do you agree with that, or do you harbour more serious concerns about such a thing?
Well, look, I think the important thing about vaccines is that when you've got a novel virus, the safety and regulatory framework around how that vaccine is rolled out needs to be very, very consistent internationally. And that essentially means that we have evidence in the scientific literature of precisely the effect that this vaccine had in its phase 1 trials, and that evidence is shared as widely as possible. We don't have that evidence at the moment, and so once we get it, if it was to demonstrate that the virus was safe, effective, induced an antibody response, then that would meet criteria to move to the second and third phases of the trials. But it just highlights the importance of making vaccine data as transparent as possible, and equally having a very strong regulatory framework, which Australia has.